today I'm going to talk about a few exercises that you can do if you have active back pain that maybe just began and you need to just move your back a little bit. So these exercises are pretty easy. They get some gentle range of motion in the back. The key point of any exercise when you have back pain is to stop if the pain while you're doing the exercise is increasing, okay? Or if the pain after the exercise increases and doesn't go away, okay? Also, if your pain during the exercise, maybe you had a little bit to start with, but it's starting to go down as you do the exercise and you have less pain after the exercise, then it is okay to do the exercise. So listen to your body as you're doing these. It will tell you if it wants to do it or if it doesn't, okay? And for some of these exercises, you can have some pain and stiffness at the very beginning, and the exercise will help that pain and stiffness kind of work out of the back, okay? All right, so first one, we're going to be laying down on your back. You can lay in the bed, on a couch, on the floor if you feel comfortable getting up and down off the floor. First one's just a lower trunk rotation. You're going to have your knees bent, feet flat on the floor, and you're just going to bring your legs side to side. And you're going to go as far as it feels comfortable. This one should feel pretty good. Now, if you're having trouble going to one side compared to the other, just go to where you touch the pain and come off of it, okay? Don't go really far into the pain. Just touch it, come off. And you can do this about 20 times. You can do about 1 or 2 sets. Next one is posterior pelvic tilt, okay? These are just pelvic tilts, and what that means is you're flattening the back, you're moving your pelvis, moving it up. It's posterior pelvic tilt, so kind of curling up. Low back goes into the mat, curling back down, giving a little bit of a back bend there. All it is some simple range of motion of the lumbar spine of the low back. And you're kind of going, rolling back and forth on your sacrum, okay, that triangular bone at the base of the spine, and you're just going back and forth. This exercise in particular can feel really stiff and a little painful when you first start. What you're looking for is that it feels better at repetition 20 than it did the very first repetition, okay? And it shouldn't have any increased pain after doing them as well. If it does, go ahead and stop. Now after this, you can do a few bridges. I would go ahead and put yourself in that posterior pelvic tilt, okay? Curl that pelvis up, put your back flat on the floor, put your hands by your sides, okay? And then push through your feet and raise your bottom up as far as it feels comfortable, holding that tummy in as much as you can, all right? You can hold this here for up to 10 seconds. If you don't feel like you can do that, just bring it on down. If you're holding longer, do less reps. So if you're holding 10 seconds, you just do 10 of them. If not, maybe do 2 sets of 10 if you're not holding them that long. And then after that, you can stretch the back out gently with some single knee to chest. That's just bringing one knee into the chest. If you're feeling really tight and very painful, you can keep this other knee bent with the foot on the floor. If you're feeling like you can go further, you can straighten out the leg. Okay, that's going to give a little stretch to that hip flexor on the other side, and that's going to be really good for low back pain as well. And again, this should not increase your pain. If it does, you need to go ahead and stop. But if you do have a little pain during the exercise that goes away while you're doing it, that is fine. Also with this one, you want to hold it for a little bit because this is a stretch. It's a stretch from the muscles in the low back. So you want to hold it maybe like 15-20 seconds and then switch sides and hold that one 15-20 seconds. And do a total of 4 on each side. Next, we're going to do just a couple of stretches. Okay, first one's going to be a hamstring stretch. Keep the leg that's not being stretched bent and the foot on the floor. And then you're going to grab behind the thigh at the hamstring itself and the leg that's being stretched. And then you're just going to stretch it up as far as it feels comfortable. It might be here, it might be here, it might be here. So wherever you feel a nice stretch, you're just going to hold it. You're going to hold it for about 30 seconds. And then switch sides. Now, and you'll do 3 times on each side. Now I'm fairly flexible, okay? So if I feel fairly flexible and I feel like I could go a little further, I can straighten this bottom leg, okay? If it feels comfortable. If it doesn't, keep it bent. You will be able to stretch further with the leg bent than with it straight. Last exercise is a piriformis stretch. Piriformis is a muscle and under the gluteals. It can get very, very tight, okay? And so it's really nice to stretch it out. You're gonna take one leg and put that ankle on the other knee. And there's a couple different ways to do this. You can push down on this knee, and if you're feeling a nice stretch right here, just stay right there. 30-second hold, switch to the other side, do each side 3 times. If it's not feeling like much of a stretch and you feel like you could go a little further with it, take this knee and bring it to the opposite shoulder. And then hold that 30 seconds. Do that 3 times. And again, you can do this one with this leg bent or this leg straight. And that is all I have for you for today.